Good evening, guys. Discussion D is the connection between Alzheimer's and metabolic syndrome. So we're going to go through that tonight for discussion D. Please join me in tonight's presentation D. Okay, here we go. The article explores the connection between Alzheimer's disease, AD, and metabolic syndrome, METS, a cluster of conditions including diabetes, obesity, high blood pressure, and abnormal blood fat levels, uh, dyslipidemia. Researchers have found growing evidence suggesting that metabolic disorders may play a role in Alzheimer's development, but the precise biological mechanism remains unclear. A new lecture review led by Professor uh, Yanpeng Yam Yan Ping Sun and Professor Lan Tan examines these relationships in depth, aiming to clarify how each component of METS might contribute to Alzheimer's pathology. Given the rising prevalence of AD, with cases projected to reach 150 million worldwide by 2050, understanding these links could be vital for future preservation and treatment strategies. Okay. Would you like me to help find additional studies on this topic, given your deep engagement with dementia research? This could fit into your broader interest in emerging innovations and metabolic influences on cognitive decline. The biological mechanisms linked to metabolic syndrome, or METS, and Alzheimer's disease, AD, are complex and multifaceted. Here are some key pathways researchers have identified. Okay, insulin resistance and amyloid accumulation. METS often leads to insulin resistance, which disrupts the brain's ability to clear amyloid beta proteins. Excess insulin interferes with AB clearance, contributing to the formation of amyloid plaques, a hallmarker for AD. Okay. Give me 1 second, guys. Okay. Neuroinflammation and oxidative stress. Chronic inflammation and oxidative stress, common in METS, damage neurons and accelerate cognitive decline. Elevated levels of reactive protein or CRP and interleukin 6 or IL-6 have been observed in METs patients, linking systematic inflammation to neurological or neurodegeneration, blood brain barrier or BBB dysfunction. METs can METs can impair the BBB, allowing harmful substances to enter the brain. This increases vulnerability to neurologic effects and accelerates AD progression. Marty, Marty, Mitochondrial dysfunction. Metabolic disorders disrupt mitochondrial function, leading to energy uh, defects in neurons. This contributes to synaptic dysfunction and cognitive decline. Dyslipid, dyslipidemia and lipid metabolism disruptions. The brain is largely composed of lipids, which are crucial for neural function. Dyslipidemia, abnormal blood fat levels in METs, may impair lipid metabolism, affecting neural integrity and increasing AD risks. Okay, gut microbiota dysbiosis. Emerging research suggests that METs alters gut microbiota composition, which may influence brain health through the gut brain axis. Renin, renin angiotensin system or RAS alterations. METs related hypertension affects the RAS, which plays a role in neural inflammation and cognitive decline. Angiotensin receptor blockers like losartan and candescent have shown neuroprotective effects. Given your deep engagement with dementia research and metabolic influences on cognitive decline, would you like to explore potential intervention strategies such as dietary modifications and pharmacological approaches? These There are promising developments in GLP-1's receptor angiosis and intertransient insulin therapy that might be relevant to your broader interest. There are several promising interventions for metabolic syndrome, METS, and Alzheimer's disease that target both prevention and management. Here are some key strategies: lifestyle and dietary interventions. Mind diet, a combination of Mediterranean and DASH diets, emphasizing leafy greens, berries, nuts, whole grains, and fish, has been shown to reduce dementia risks. Exercise, regular aerobic exercise improves insulin sensitivity, reduces inflammation, and enhances cognitive function. Studies suggest 650, 660 METs minimum week is optimal for cognitive benefits. Intermittent fasting may improve insulin regulation and reduce cognitive decline. Stress potentially slowing neurodegeneration. Pharmacological approaches. GLP-1 receptor antagonist. Originally for diabetes, drugs like liraglutide and semaglutide show promises in reducing neurotransmission and amyloid buildup. Transient insulin therapy directly targets brain insulin resistance, improving cognitive function in early AD. Okay. Angiotensin receptor blockers, or ARBs. Medications like losartan may protect against neuroinflammation linked to METs. Cognitive behavioral interventions. Cognitive stimulation therapy. Structured activities that enhance memory and problem-solving skills. Reminiscent therapy, or RT, uses past experiences to improve mood and cognitive function. Environmental modifications. Adjusting lighting, uh, signage, and color contrast can reduce confusion and improve independence. Social and caregiver support. Peer support counseling reduces caregiver burden and improves coping skills. Okay, mindfulness based stress reduction helps caregivers manage stress, improving patient outcomes. Would you like to explore specific interventions in more depth, given your focus on dementia prevention? Also, metabolic influences and cognitive decline. I can help find additional studies or practical applications, lifestyle changes, and pharmacological approaches. Both play a crucial role. Both play crucial roles in managing metabolic syndrome or METS and Alzheimer's disease AD, but they differ in their mechanisms, effectiveness, and long-term impact. Lifestyle changes. Mechanism targets root cause like insulin resistance, inflammation, and cognitive stress. Effectiveness can prevent or slow progression of METS and AD, especially when implemented early. Long-term impact, sustainable and low risks, with benefits extending beyond cognitive health, e.g., cardiovascular protection. Examples: mind diet, exercise, intermittent fasting, cognitive stimulation therapy. Pharmacological approaches. Mechanism directly modifies disease pathways, such as reducing amyloid buildup or improving insulin sensitivity. Effectiveness often 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 faster acting, but may require long-term use to maintain benefits. Long-term impact can have side effects and may not address underlying lifestyle factors. Okay, examples: GLP-1 and GLP-1 receptor angiogenesis, intertransient insulin angiotensin receptor blockers. Combination approach. Recent studies suggest multimodal interventions combining lifestyle changes with pharmacological treatments may be the most effective strategy. For example, the Medfinger trial is testing a lifestyle metformin combination to prevent cognitive decline. Okay, would you like to explore specific interventions in more depth? Given your focus on dementia prevention and metabolic influences on cognitive decline, I can help find additional studies or practical applications. Okay, guys, so that is it for tonight. For shows. I will see everybody tomorrow. For now, Gator Wellness. Take care, folks.